Coming to history, etio-pathogenesis, types, clinical and radiographic features of ameloblastoma. Ameloblastoma is an epithelial odontogenic tumor. There is no participation of odontogenic ectomesenchyme in its formation. It is locally aggressive neoplasm and second most common odontogenic tumor after odontoma. It is a true neoplasm of enamel organ tissue. It is benign tumor. Here, the differentiation of enamel organ to enamel doesn't occur, and this neoplasm originates from odontogenic epithelium. The term ameloblastoma is derived from two words, amel and blastos. The amel means enamel and blastos means germ cells. So, it is a tumor which is derived from those cells which form enamel. In this case, enamel organ type cells. Coming to history of ameloblastoma. Melasses in 1885 gave the term adamantinoma. In 1934, Churchill coined the term ameloblastoma. Robinson termed the tumor as unicentric, non-functional, intermittent in growth, anatomically benign, and clinically persistent. Etio-pathogenesis of ameloblastoma. The epithelial component of developing tooth germ is believed to be the source of origin of ameloblastoma. At present, we believe that ameloblastoma arises from enamel organ rests. Ameloblastoma can also arise from remnants of dental lamina, epithelium of odontogenic cysts, or basal cells of surface epithelium. The epithelium of odontogenic cysts can give rise to unicystic ameloblastoma, whereas peripheral ameloblastoma is believed to arise from basal cells of surface epithelium. Statistical figures. Ameloblastoma accounts for 1% of all tumors. It is estimated to be 11% of all odontogenic tumors. There are many types of ameloblastoma, but solid or conventional ameloblastoma is most common type. Peripheral ameloblastomas involve soft tissues only. Ameloblastomas are seen more in males than in females. It is seen in third, fourth, or fifth decades of life. It commonly occurs in middle age. It involves molar region than incisor or canine region. It is common in mandible than in maxilla. 75 to 83% of ameloblastomas are in mandible, whereas only 15% are seen in maxilla. If it is seen in maxilla, it can extend up to maxillary signs and floor of the nose. Coming to clinical types. The intraosseous ameloblastomas are of solid and unicystic variety, whereas extraosseous ameloblastomas are mostly peripheral. Desmoplastic ameloblastoma is a subtype of solid variety but has characteristic clinical and radiographical properties. Coming to clinical features. The growth of ameloblastoma is gradual. It is a central lesion of bone that tends to expand bone rather than perforate it. Causes facial asymmetry and it is initially asymptomatic. Intraorally, it causes displacement of teeth. It causes increased mobility of teeth. Ameloblastomas can also cause tooth resorption. Long-standing lesions of ameloblastoma are painful. These cause paresthesia, especially if lesion is pressing against nerve. The shape of the tumor is ovoid or fusiform. Consistency is hard and it may be tender. Untreated ameloblastomas are large. They are asymmetric and disfigure the face. Untreated ameloblastomas are largely ulcerative. They are fluctuant and have eggshell crackling. Maxillary ameloblastomas tend to spread more extensively than mandibular counterparts. Usually, there is involvement of paranasal sinuses, orbit, and nasopharynx. Maxillary ameloblastoma can extend up to cranial base. Coming to radiographic features. Radiographically, ameloblastoma is a radiolucent lesion. The lesion is surrounded by sclerotic borders. Radiolucency can be unilocular or multilocular. The multilocular can have soap bubble or honeycomb appearance. Honeycomb appearance has small, well-defined radiolucent areas, whereas in soap bubble, the compartments are large. It is believed that compartments are formed due to trabecular pattern of bone. Some researchers say that compartments are due to reactionary bone response to the lesion. To summarize, I have discussed history, etio-pathogenesis, epidemiology, statistics, clinical and radiographic features of ameloblastoma. Thanks.